Hey guys, what day is it? It's Tuesday. Tuesdays with your favorite nurse, Tuesdays with Lori, and you guys are in for a huge treat. You know, there's no topic I will not discuss. And you're here with a master. This is Dr. Reed, and we actually, our paths crossed in Scottsdale, Arizona.
Right.
We were both there for the Alma,
Yep,
the
yep.
Alma event.
Absolutely.
And I just thought, you know what, this is a service that I've wanted to be able to offer my clients. Nobody really in my area that does this.
Okay.
And there's been a request, so I'm gonna let you educate my viewers and educate me both.
Sure.
And we're gonna do the little icebreaker. You better have the right answer or we're not gonna be friends anymore. Are you a dog person or are you a cat person?
I'm a dog person.
Okay, we're friends. We're friends
Dog
now.
person for sure.
What kind of dog do you have?
I don't have one, but I like big dogs.
Okay.
Because they're cuddly, they're warm, they're affectionate, and they just show you when they need you, and they reciprocate by giving you love back. So
And they got
always
your
got
back.
to go a dog. That's right, loyalty.
I've got a wolf mix and I have a boxer, so
Oh, nice.
I've got big boys too.
Yeah.
And you're gonna have to stay tuned because I'm having a fundraiser for Sacramento Shelter Pets Alive.
Okay.
And maybe we could dang a little carrot and have something in the drawing for one of the services that you offer.
Sure,
Get
yeah.
some people down here.
Absolutely.
So without further ado, Dr. Reed is going to educate you about all kinds of stuff. All you wanted to know about vaginas and ways that we can help keep them young and more functional.
Absolutely.
Right?
Absolutely.
So tell us a little bit, what inspired you to even get into gynecology and women's health?
Women's health in general is something that I found so attractive to me when I was going through medical school. And just the idea that you're helping women be successful in numerous different ways. And being able, most of the issues can be corrected and fixed. And so I really like the idea of being able to see a problem, address a problem, and then come up with a solution.
Wow.
So I've always had the idea of always having awareness, educate the patient,
Absolutely.
provide options, and then hopefully we come up with solutions.
Yeah, treatment plan together.
Absolutely,
Right?
yeah.
With budget and other things, I'm sure play a little bit of a part in it. How long have you actually been at this location in Davis?
We've been in Davis now for a little over a year and a half. I did a fellowship with Dr. Goodman. He wrote the textbook when it comes to female cosmetic surgery. And so I've just been understudy with him for the last year, learning all the new tips, tricks, and just
awesome.
really just developing an aesthetic eye to do this for women. I think that is one of the biggest misconceptions that women have about labioplasty, is that any surgeon can do a labioplasty.
Yeah, and that's
Not
the
the
case.
case.
Right.
I mean, if that were the case, we wouldn't have botched labioplasties. We wouldn't have ongoing pelvic pain after labioplasty.
Yeah.
And that's because a lot of times they're picking the wrong surgeon. And they need to find a surgeon who is experienced, who has been educated, and has done the right things to provide the best outcomes for women.
I know at one point in time I was able to offer Thermiva. I was trained by Dr. Alan Sod down in Orange County.
He's a good friend of mine.
He's like a master. He was
Absolutely.
amazing. I learned a lot from him. I no longer work for that physician, so I don't offer that service. But I'm just being honest, RF, I didn't think really did it for me. I didn't really see anything really tightening up. Sometimes you got to take it a little bit more aggressive. Tell us a little bit about your laser for treatment of the stress incontinence and just to kind of help tighten up the canal.
Yeah, so lasers have their place. The place that it's not very good at, whether you're using laser or radio frequency, is what you've pointed out, is vaginal tightening. At most, we can see a 10% increase in vaginal tightening, and I almost don't even talk about vaginal tightening when it comes to the laser, because usually when there are issues of vaginal looseness or feeling white, there's usually due to injury to the muscles of the vagina.
Okay.
And putting a laser onto the vagina is not going to correct the muscles.
Okay.
It'll tighten the skin just as it would on the face,
Right.
but it's not going to have any sustainable long-term tightness available. However, laser is really
mind-blowing to me. I'm learning so much right now.
laser is really good when it comes to stress urinary incontinence. It is, you know, middle of the road. It's non-surgical. I mean, obviously the gold standard is to do a sling procedure, but not everybody wants to have surgery. If you're having mild to moderate stress urinary incontinence, this could be completely adjudicated using laser therapy. The other place, and the other thing that women need to understand is that we have to stop being silent about these issues. There's so many women that I see on a day-to-day basis that feel as though they're the only one experiencing these symptoms. And the fact is that women are experiencing these symptoms, and women need to share this. I mean, women share their birth story all the time, but why won't they talk about
the vagina? Right. I don't know.
Talk
Except
about
for me,
menopause.
I talk about everything.
But besides stress urinary incontinence, there's another condition called genital urinary syndrome of menopause. 100% of women will experience vaginal atrophy if they're not on some form of hormone replacement therapy. And so having laser treatment can actually make sex pleasurable, exciting, more easily to be aroused, more likely to have orgasm, because they're not having pain and discomfort.
Right.
And so these can easily be treated both non-surgically, genuine stress incontinence, as well as vaginal atrophy, or what we call GSM.
So I just wanted you to expand just a little bit more about the surgical part. What is the surgery called, and what is involved in it?
So when you're talking about vaginal tightening, there's a word that's out there. It's called vaginoplasty. Vagina is the vagina. The O is the combination. Plasty is to repair or to restore.
Okay.
So vaginoplasty, restoring the vagina. A more complete and appropriate term would be complete pelvic reconstruction.
Okay.
So if we think of the vagina as a tube but cut into thirds, there's an upper third, middle third, and a lower third. The upper third has no muscles in there that's needed for repair, but it does allow the vagina to expand, accommodate different sized penises, and that's kind of where the top of the vagina, the upper 1/3 of the vagina. This is where I step in, is in the middle third of the vagina. And this is where we actually take muscles of the vagina and bring them in closer proximity to each other in the midline. By bringing those muscles closer in, we're actually going to decrease the internal diameter of the vagina. The last part is the lower 1/3 of the vagina. After having children and age, the vagina loses its angle of penetration and becomes more horizontal. Well, all of the goodies are on the anterior vaginal wall. That's where your G-spot is. That's where your clitoris is. So if you've lost that angle, you're not getting much friction against the goodies.
Right.
So what we do is we actually build up the muscles around and near the perineum to recreate the downward angle, so that the stroke of the penis, toy, or finger presses more so against the G-spot, and hence greater likelihood of vaginally activated orgasms.
So now, does any of the repair address stress incontinence?
No.
Okay.
So that would involve more of the anterior vaginal wall.
Okay.
Stress incontinence can be treated. The gold standard is sling procedure. You can do what we call an anterior repair. It's kind of and then in the middle of the road, non-surgical, is the laser therapy that we talked about earlier.
And the name of the device?
There's different ones, but
Okay.
I have FemiLift, which is fractional CO2. It's supported by NAMS, the North American Menopausal Society,
Okay.
as well as ISHWISH, the International Society for the Study of Women's Sexual Health. Fractional CO2 lasers are considered
That's
prime
gold standard, right?
prime treatment. Yeah.
Right.
Yeah.
Tell me, if you don't mind, like, is there other treatment option? What is the treatment? How long does it take for the procedure? What is the recovery like?
So the procedure itself there's no downtime, other than no sex for 5 days after the procedure.
And we're talking about the surgery as well as laser?
No, we're just talking about laser right now. So
okay,
laser,
5 days.
FemiLift,
Yes.
Mona Lisa, those are equivalent. They're exactly the same. They're both fractional CO2 laser machines. The only downside is no intercourse for 5 days, but it's non-painful. It takes about 2 minutes, and it consists of 3 series of treatments, each a month apart.
Okay.
Usually women will see significant difference after the second treatment, not so much after the first. but hopefully by the third there's complete adjudication of genuine stress incontinence or vulvovaginal atrophy that we kind of discussed earlier.
I love the technical terms.
Yeah.
Vulvovaginal atrophy. It's a mouthful, but by the end of the interview I'll have it down, I promise. So surgery, what is the recovery like for that?
So recovery after surgery, the first 3 days are pretty difficult. I mean, we like you to rest. We give you medications that help you to rest to control pain. At about a week's time, most people, 50% of the people, are able to go back to work if they're not working too strenuously. Another 50% might need another 3 to 5 days afterwards to get to the point to where they feel real comfortable in working, and depending on the realities of their job will kind of dictate that. But the things that I hear most often is a heavy sensation in and around the rectum to where it can feel like you're having a bowel movement or need to have a bowel movement. But other than that, generally by 2 weeks' time, they feel pretty much themselves. We generally have to remind them that you've had surgery, not to lift heavy weights, and take your time getting back into the gym.
And how long prior to having sex after
Sex
surgery?
is 2 months.
Okay.
2 months before you can have intercourse.